Congestive heart failure, CHF, is a chronic condition in which the heart struggles to pump blood effectively to meet the body's needs, often leading to fatigue and other serious health issues. Patients with CHF may experience a spectrum of symptoms, the most prevalent being shortness of breath, swelling in the legs and ankles, and persistent coughing or wheezing. Excessive sleepiness, or sleeping all the time, known medically as hypersomnia, can also occur in CHF sufferers due to reduced oxygenation and the body's attempt to conserve energy. Treatment for CHF often involves a combination of lifestyle changes, medications, and sometimes surgical interventions to manage symptoms and improve heart function. Known risk factors for developing CHF include high blood pressure, coronary artery disease, previous heart attacks, diabetes, and obesity. Here's a detailed look at the various facets of congestive heart failure and its impact on patients' daily lives, including their sleep patterns. Affected systems: cardiovascular versus neurological. When considering congestive heart failure, CHF, and its connection to excessive sleeping, it's crucial to delve into the interplay between the cardiovascular and neurological systems. CHF leads to reduced blood flow and subsequent oxygenation to various organs, including the brain. This can induce fatigue and lethargy, making patients sleep more. On the other hand, hypersomnia could stem from primary neurological conditions unrelated to heart failure, such as sleep apnea, narcolepsy, or depression, which can themselves exacerbate CHF by disrupting sleep patterns and causing physiological stress. Distinguishing the root cause demands a holistic approach, incorporating cardiological assessments like echocardiograms along with neurological evaluations through sleep studies and mental health screenings. Addressing both systems is often paramount in managing symptoms and improving the patient's quality of life. Primary symptoms: fluid retention versus chronic fatigue. Congestive heart failure, CHF, can lead to fluid retention as the heart's reduced pumping efficiency causes blood to back up in the veins, leading to the heart. This results in edema, particularly in the legs and abdomen, and can cause shortness of breath due to fluid accumulation in the lungs. On the other hand, excessive sleeping or chronic fatigue could have a multitude of causes, from depression to sleep apnea or even infections. In CHF patients, fatigue is also common as tissues receive less oxygen-rich blood, but it's crucial to differentiate whether the tiredness is due to heart failure or another underlying condition. This distinction is vital since it directly influences management strategies and therapeutic interventions, affecting the patient's quality of life and prognosis. A thorough examination using diagnostic tests such as echocardiograms, blood tests, and sleep studies may be required to pinpoint the exact cause of such symptoms. Underlying causes: heart dysfunction versus sleep disorders. Congestive heart failure, CF, is often associated with excessive daytime sleepiness due to impaired cardiac function, which limits oxygen-rich blood flow and can lead to fatigue and lethargy. However, it's essential to differentiate whether the constant need for sleep is directly due to CHF, or if a sleep disorder, such as sleep apnea, which is prevalent in patients with heart failure, might be contributing. Sleep apnea causes interrupted sleep and oxygen desaturation, exacerbating CHF symptoms and increasing the risk of arrhythmias. Therefore, any patient with CHF reporting excessive sleepiness should be evaluated for sleep disorders, as their management may substantially improve the overall quality of life and potentially the prognosis of CHF. Diagnostic criteria: echocardiogram findings versus sleep study results. When comparing congestive heart failure, HF, with excessive sleepiness, one must look at specific diagnostic criteria. Echocardiogram findings in CF typically reveal a compromised heart with abnormal pumping function, for example, a low ejection fraction indicating reduced blood flow. In contrast, a sleep study might unveil sleep apnea or other disorders causing excessive sleepiness. These two conditions can also coexist, exacerbating each other. Poor sleep can worsen heart failure symptoms, and a failing heart can disrupt sleep patterns. A careful evaluation combining cardiac imaging with sleep assessment is crucial for accurate diagnosis and efficient management of these potentially interrelated conditions. Common treatments: diuretics and ACE inhibitors versus CPAP and sleep hygiene counseling. Congestive heart failure, CHF, often leads to fluid retention, causing shortness of breath and reduced oxygenation that can disrupt sleep patterns and induce excessive daytime sleepiness. Diuretics are commonly prescribed to alleviate fluid overload, easing symptoms and improving sleep indirectly. ACE inhibitors are used to relax blood vessels, enhance blood flow, and ultimately reduce the work of a compromised heart. On the flip side, conditions like sleep apnea, which might cause someone to sleep excessively, are treated with continuous positive airway pressure, CPAP therapy, to maintain airway patency and improve oxygenation during sleep. Additionally, sleep hygiene counseling is vital, focusing on creating an optimal sleep environment and routine, which can be beneficial for both heart failure and primary sleep disorders, addressing the interconnection between restorative sleep and heart health.